Future nurses, use the mnemonic COCA when assessing your wound drainage. Let's clock it. Now, the C stands for color of the wound drainage. And then the O is for odor coming out from the wound or the wound drainage. C is for consistency. If it's thin, if it's thick, fluids coming out from the wound. So, consistency of the wound drainage. And lastly, A is for the amount of the wound drainage. Now, let's talk about these 5 types of wound drainage. Now, when assessing a wound, the types of drainage coming from the wound tells us about the healing, infection, and tissue health of the wound. Now, the first drainage we talk about is the serous drainage. Now, in terms of the appearance, it is clear, thin, watery drainage. The cause/source is normal plasma or serum. Now, example of serous fluid is fluid in blister or surgical incision. Now, teaching tips for students. Serous drainage is clear and it signifies good healing. The next drainage is sanguineous. The appearance is bright red. The consistency is thin and watery. The cause/source is fresh blood from capillaries. That signifies active bleeding. You will see sanguineous drainage in immediate post-surgery or in trauma. Small amounts of sanguineous are expected in early wound healing, but large amounts of sanguineous may indicate hemorrhage, that is active bleeding, hemorrhaging. The next drainage we talk about is serosanguinous. The appearance is pink or light red. The consistency is thin and watery. The cause/source is there is mix of serous fluid, which is clear fluid, plus blood, and that's why you see the pink or light red color. This is normal in new surgical wound. Now, Enkles hint, it is considered normal after surgery, post-op, but make sure to monitor the amount. The next one is purulent. Now, the appearance is thick, yellow, green, or brown, and the consistency is pus-like, or it can be cloudy. Concerning the drainage. Now, the cause of this or source of this will be infection. Okay, this drainage contains dead white blood cells, bacteria, and tissue debris. So this is a cause for infection alert. Enkles tip: always assess for odor, redness, swelling, and fever. Okay, when your patient have purulent drainage, assess for these things. Okay. The last drainage we'll talk about is seropurulent drainage. Now, the appearance of this drainage is cloudy, yellowish pink. The consistency of this drainage is mix of serous fluid plus pus. The cause/source of this drainage is early infection or inflammatory response, and this is sometimes seen in healing wound with mild infection. And so you have to keep an eye on it. You have to monitor this drainage and this wound. Okay. Now, Enkles tips: always note the color, consistency, amount, and odor in documentation. Make sure to always document these findings. And for the amount, it can be scanty, moderate, or large, the amount of the drainage. And when there is foul odor from a drainage or wound, it signifies infection. Lastly, if there is purulent drainage, assess patient for infection signs and immediately notify the healthcare provider. All right, guys, take care until next time.